This is the part that I'm going to explain about other types of diabetes a little bit, and this is just a fun fact, but I guess it's interesting. The word diabetes comes from Latin, and it means siphon. Um, it was used to describe the number one symptom of diabetes, which is excessive production of urine. People that are urinating all the time, and try not to confuse this with like when you have a urinary tract infection that you want to go to the bathroom all the time and you just pee a little bit. No, in this case, it's the people who go to the bathroom like twice an hour or maybe once every hour, and you pee a lot. That's why they call it a siphon, because they're always passing water and water and water. That's what diabetes means. And the thing with this is that before we had tests for diabetes, the only way that doctors had to diagnose it, and I know this will sound funny, but it's an important part of medicine and a fun fact to know, they used to taste the urine of patients. And they discovered that patients that had the same trouble, which was urinating a lot, some of them, their urine tasted sweet, like honey. In Spanish, we say honey, we say miel. So they call it diabetes mellitus, that comes from honey. And they discovered that some other patients, their urine didn't taste like anything. And they named that diabetes insipidus. Insipidus means tastes like nothing. So that's other type of diabetes. That's a fun story. I hope you liked it. But that doesn't have anything to do with blood sugar, so that's why I'm not going to talk about that. But I want you to remember that diabetes mellitus, number one symptom, urinating a lot. We call that in medicine polyuria. Second symptom that you might have, constant thirst. And of course, this comes together. If you're urinating a lot, if you're going to pee constantly, then of course you're going to be thirsty all the time. So this is number two. We call that in medicine polydipsia. And the third one, it's being hungry all the time. We call that polyphagia. And this becomes the triad of diabetes: peeing a lot, having thirst all the time, and being hungry all the time. So if you have these symptoms, you better get checked. That doesn't mean you have it, but at least you should be checked for that. Of course, there are other symptoms which might be headaches, dizziness, vision troubles, many others, but they're not very specific to diabetes. And of course, similar to high blood pressure, the symptoms might remain very silent for a long period. So that's why now we check people even if they don't have any symptoms, because you might not feel anything, but that's damaging your body already.